There are millions of sickle cell disease sufferers worldwide. In Ghana, approximately 15,000 babies are born with the disease to unsuspecting parents annually. Peter Amponsa is an accountant who has lived with the disease all his life.
I'm sickling SS. I've lived with this for well over 40 years. Maybe since this is public, I wouldn't want to put my exact age, but I'm well over 40 years now. My own mom was also sickling SC. And that presupposes that my dad was AS. That is how come I would be SS.
The prevalence rate for the disease in Ghana is 25%. The pain, stress, emotional trauma, and its numerous side effects are devastating.
Imagine having leg ulcers on both feet for 12 good years. Honestly, it's now that I'm trying to rebuy another shoe, because for the past 12 years I've never worn a shoe. Maybe for only 3 times when I went for interview at KNUST, and then on my wedding day, and then when I was going for promotional interview. So for those few hours, I had to bandage my feet. This is just one example. Imagine being in the hospital, all the stress and all that, blood transfusions here and there. It's a hell. Like having to move to work with little energy. All through my life, my average HB level, that is my blood level, has been 7.5. But the average human being, male, I think should be about 14.8. So if you meet somebody whose blood level that he has been moving all along with all these over 40 years, 7.5, then you can imagine what the hell the person will be going through.
Couples who missed genotype testing in influencing choice of partners have come to bear the agonizing lifelong moments of caring for children with sickling conditions.
Being female, being female, and the bad in the because you buy any day, your main crew. This uncle, they could be for not to be one idea pay 2 year man oxygen. You never be put you can ask you never be in a post. Like a minute for a boy. 24 or so, but no one or complaining. Mamma may yam, may lie, may slip, may suck, and although beating you soon, or once one article, a bounce one, a buyer, not why you fit. He said, you come hospital. That's how I want to. It's a very fast one, the buyer.
Sickle cell disease is an inherited blood disorder in which red blood cells contain an abnormal type of hemoglobin and frequently takes on a sickle or crescent shape. These defective red blood cells can block small blood vessels, preventing oxygen from having access to other parts of the body, which can lead to tissue damage or even stroke. Other complications are anemia, gallstones, severe leg and arm pains, and spleen, liver, and kidney damage. Living with sickle cell comes with extreme emotional stress. The knowledge that you can die at any time, the financial burden of staying alive is traumatizing.
It's very serious because one, you can die at any time. I've experienced a lot of people who have passed away. For the purposes of, because this would be in the public domain, so I don't want to mention name. There is a particular family here in Ghana that everybody knows. Everybody knows that family. In that family, there are medical doctors, there are what and what. One of them, they are very influential. So if such a family with all the resources at their hands, at their disposal, and then all the medical doctors that one can think of would lose one of their own, a child of theirs, to sickle cell. There's a professor at K University here who is on retirement now. At least I know that he has buried at least not less than 4 of his children due to sickle cell. Putting that aside, there's loss, the economic implications, the social implications. Imagine, as I was saying, for about 3 weeks I've not been to work. The economic implications. I know my parents have to spend a whole lot on me.
Meet Dr. Brown Osekunadu, a dietitian, physiotherapist, and gymnasium instructor. In 2006, a life-threatening event took place in his life that got him to make a covenant with God.
It was a contact between myself. I was a seaman before, and it's a route between myself and my colleagues. Eventually, I fall into the sea, and eventually I could not die, melt sea. And that time, how I was received, God sustained me with that power, and I was alive. I became alive, and I make a covenant, say, holy covenant. That is the time I made with God, that I will serve people. It has continued even up to now.
He couldn't bear the agony that needy children with severe sickling status go through on daily basis.
People that come visit my center, and I title my center Holy Covenant Health Center. That's my clinic, the name of my clinic. So I started receiving patients. And one of these days, I come in contact with people. I have a lab technicians there. When you come to my end, and I first direct you to the lab technician, the technician will now discover SS, sickle cell anemia, in their report. So whenever I receive that report, and I look at these children, how they feel pain, see pain, yellowish eyes, some tears in their eyes, some have syndrome from their arms, some have long-term constipation. When I ask them, 4 days constipation, you are not visiting the washroom for 3 days. What's wrong? I discover what type of disease is that. There I discover it's sickle cell anemia. From there I have to call your mom and your dad to examine them. After I discover this ASAS, meaning ASAS, we discover SS, meaning the baby pick S from the mother side, partner A and partner B. They pick it before that person contacts that disease.
Dr. Brown set up the Blood and Genotype Awareness Foundation, BGAF, in Ghana. It was registered as a non-profit, charitable and non-governmental organization in 2009 with the objective of creating awareness about the sickle cell disease. He now helps the sickle but needy with encouragement, medication, food and financial support. Orphans like little Beyonce turn to Dr. Brown. Her grandmother has lost her petty trading job to her medical upkeep.
Ni ebe Daniel tantan ye friji enti ehore de ma bere papa ena sisi akure mene wo sa anti koduru mrebere se mene sika me de be ko doctor bia biem mene sika ye de bedidi na da satan so da akora no wa fon ya na school kura no ntimi nkobi.
But this is a preventable condition. It starts with knowing your sickling status or genotype and seeking medical advice on the possible sickling status of your unborn baby. Dr. Brown believes the future of this campaign is to get this education to Ghanaians everywhere. He has printed and mounted a chart for the genotype pairings for couples, placing it boldly in front of his fitness consulting center here at Bomso in Kumasi.
Sometimes people come in here, schools at Bomso, they will come down here for a sketch. The teachers will be teaching them. I've told them. I have flyers are distributed to about 500 churches, to the marriage committee, to check these first. Not even prayer, not deliverance, not prophecy alone. But ministers also care. Because ministers command a number of people from the churches, from the mosque. Yes. These pastors command people. So why can't that pass through that area? And truly, these churches have responded. And they are doing it. So that banner has been there since all these years. People come down to capture, schools come down to capture, even the KNST. They come down and they capture the photo. I've put it in the social media for every individual by the year 2030. I don't want sickle cell patients, sickle cells to be born here in Mother Ghana.
The foundation now organizes awareness creation trips to churches, schools, and fora to educate people on the need to know their genotypes and adhere to strict compliance with informed choices to avoid giving birth to sickle cell babies. It is not then surprising that Dr. Brown has received many accolades for this achievement. It is the dream and goal of the Blood and Genotype Awareness Foundation, BGAF, to secure resources to spread the word with the hope of reducing drastically the number of children born with the disease. BGAF, since its inception, has visited over 500 churches, schools, cooperative institutions, and social groupings to educate them on the need to maintain good health by adopting quality eating habits, engaging in regular exercises to keep fit, as well as desisting from any lifestyle that may have the potential to plunge them into serious health problems. Let's join hands, get tested, know your genotype, support BGAF to spread the word.